This is ANN News Brief.
Angolan President João Lourenço has called for increased observance of COVID-19 safety measures to contain the spread of the virus in the country. In a message to the nation, Lourenço urged citizens to keep physical distancing and avoid crowd concentrations and physical contact. He also advised citizens to wash their hands often with soap and water and to correctly use face masks. The president said unless one has been tested and declared negative of the virus, everyone should consider himself to be potentially infected, able to contaminate others. He warned that Angolans should take seriously this new reality, which he said will only be combated when a safe vaccine is discovered and distributed worldwide. He said the only way to be collectively and individually safe from the pandemic is through self-discipline and prevention. Angola now has nearly 700 COVID-19 cases with 29 deaths. 200 patients have recovered. There are nearly 450 cases active. The International Organization for Migration says thousands of Mozambican miners have been allowed to cross the border to return to work in South Africa after the country lifted its COVID-19 blockade, which has left borders between the two countries closed since March. IOM spokesperson Paul de Leon says South Africa and Mozambique have reached an agreement that would allow migrants who have been screened for the coronavirus to return to work in the country. South Africa is the continent hardest hit by COVID-19. The World Health Organization has reported nearly 340,000 persons are infected with the coronavirus and more than 4,800 have died. Mozambique, on the other hand, has reported only 1,400 cases, including 9 deaths. De Leon says at least 45,000 migrants are employed in South Africa's gold and platinum mines. He says the skills of these migrants are essential to the resumption of economic activity at those mines. The World Health Organization, WHO, says the COVID-19 pandemic and the shortage of funds are making it difficult to quickly end the Ebola outbreak in Ikoto province of the Democratic Republic of the Congo. 56 cases and 20 deaths have been recorded since the Ebola outbreak was declared on June the 1st. WHO says the availability of a vaccine and therapeutics could help in preventing the onset of the disease and treating those who fell ill. But its spokeswoman, Fadela Chaib, says it is difficult to contain the spread of the virus because cases are scattered across a remote, dense rainforest area. To worsen the situation, she says WHO has less than $2 million that would barely cover the operation for a few weeks. This is the 11th Ebola outbreak in the DRC. 2 years ago, an epidemic that broke out in the same region in the country was declared within 4 months. It's a different story now because the current outbreak was preceded by a devastating epidemic in conflict-ridden North Kivu and in Ituri provinces. More than 3,400 persons were infected and nearly 2,300 were killed in that outbreak that was declared in August 2018. The World Health Body says regardless of the complexities of responding to Ebola during the current COVID-19 pandemic, its health workers would not be distracted from tackling Ebola and other pressing health threats. That is ANN News Brief at 10. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I'm Lucy Adeyemi.